The diseases where you will find the fibro-osseous lesion are basically three. So the fibro-osseous lesion are basically find into three type of diseases. Number one is fibrous dysplasia. Another one is cemento ossifying fibroma, and third is cemental dysplasia, right? So what is fibro-osseous lesion? So basically, fibro-osseous lesion is characterized by the formation of fibrous connective tissue along with new formation of mineralized tissue. Okay, so on the background of fibrous connective tissue, this is the background of fibrous connective tissue, you will find foci of mineralization. These are the foci of mineralization. Okay, so let's discuss the first disease, which is known as fibrous dysplasia. Okay, so what it is basically, it is a skeletal developmental anomaly which is manifested as some disorder of osteoblastic differentiation, right? So this definition is given in the Schaeffer's, and according to Neville, it is a developmental anomaly which is manifested as tumor-like lesion. Okay, so what is happening here basically, the gene which is located on the chromosome number 20q13.2, so the GMAS1 gene which is located on the chromosome number 20q13.2 is affected. Okay, so what it is basically, it is a guanine nucleotide binding protein, okay, with an alpha stimulating activity polypeptide, right? And this is responsible for the cyclic AMP production. So whenever mutation takes place, there occurs overproduction, right? Overproduction of cyclic AMP, and this will affect three things in the body. Number one, they affect the endocrine system. Then it will affect melanocytes. Then it will affect osteoblasts, right? When it affects the endocrine system, we will see hyperactivity of glands. So we see the overexpression of growth hormone. Then there occurs precocious puberty. Then there occurs high production of cortisol, and the patient will suffer from hyperthyroidism. When it affects the melanocytes, then we will see light brown macules on the skin, right? And when it affects the osteoblast, then fibrous dysplasia occurs, and it will affect the bones, right? So depending upon the time of mutation, it will again divided into three categories. So depending upon the time of mutation, it will divided into three categories. When it when the mutation takes place at during early embryonic life, at very early stage, then it will affect the whole pluripotent cells. Then you will find the effect in the endocrine system also, in the melanocytes also, and it will affect bones also, right? When mutation takes place at late embryonic life, then it will affect the skeletal progenitor cell. So only bones are affected, right? And it will lead to polyostotic fibrous dysplasia. Okay. And when mutation takes place at postnatal period, then it affects only bone and only in the localized area, right? So it is known as monostotic fibrous dysplasia, right? And polyostotic fibrous dysplasia are again divided into two categories. One is known as Jaffe Lichtenstein type, right? Here what we see, it shows multiple bone involvement as we have earlier mentioned, right? And here we see cafeole spots or macules. And another criteria is known as another syndrome which is affected by the polyostotic fibrous dysplasia is McCune-Albright syndrome, right? And here we see multiple bone involvement also. We have cafeole spots also. And in the McCune-Albright syndrome, we see endocrinal abnormality. And this endocrinal abnormality usually not shown by the Jaffe-Lichtenstein's type, right? Now, remember, in the polyostotic fibrous dysplasia, the cafeole pigmentation appears on ipsilateral side, having irregular border, which is compared with coastline of Maine. Okay, so this thing is very important. That what questions they are generally formed in such a way that they ask that as we know that pigmentation is also seen in the neurofibromatosis condition, and here the margin is regular, so that is why it is compared with the coastline of California. So they ask that what is the difference between pigmentation seen in the fibrous dysplasia and neurofibromatosis. So this is the difference. The pigmentation which is seen in the fibrous dysplasia is known as coastline of Maine, whereas coastline of California pigmentation is seen in the neurofibromatosis, right? Now let's talk about the radiographical finding of fibrous dysplasia. So as we know, what is happening here is basically uh, this is the background of fibrous connective tissue, right? And here we see the mineralization, and these mineralization are present as bony trabeculae, right? So these bony trabeculae are randomly arranged, randomly arranged, so they appear very hazy. So the appearance is uh, hazy and granular. So this is known as ground glass appearance or POD, POD orange. Okay, and remember this ground glass appearance. It can also be seen in the hyperparathyroidism and cherubism, right? And when fibrous dysplasia, when it affect the femoral bone, then it is known as Shepherd's crook deformity. It is also known as autistic deformity, right? And Rind sign is seen basically in the long bones when fibrous dysplasia affect long bones. So what it is basically is a radiolucent lesion with sclerotic border, right? And we see fingerprint or thumbprint impression on intraoral periapical radiograph. Okay. Now let's see the histopathologically what we see, right? So on histopathological slide, it appears as C, K, or L-shaped trabeculae. Since we know that bony trabeculae are arranged in uh, irregular pattern, so it is known as Chinese letter pattern, and this pattern can also be seen in the cemento-ossifying fibroma, right? And there is a syndrome which is known as Mazabrod syndrome. Here we see along with fibrous dysplasia, there will be soft tissue myxoma. And if you talk about the prognosis of fibrous dysplasia, so remember the long-standing fibrous dysplasia, it can convert into malignancy. And what are the malignancies that it may convert? So remember, it may convert into osteosarcoma or fibrosarcoma, chondrosarcoma, or it can also convert into malignant fibrous histiocytoma. Thank you.